Hello friends, myself Dr. Pratibha, surgery PG resident. Welcome to my YouTube channel friends. So today is the topic of thyroid gland. Let's study on the topic of anatomy of thyroid gland. So starting with, it's a butterfly shaped organ. It is an endocrine gland which is rich in blood supply. And it is divided into three arteries, that is the superior thyroid artery, inferior thyroid artery and the IMA artery. So then next coming to the thyroid gland is situated in the lower part of the neck and the sides of the neck. Thyroid gland has two lobes, right side and left side. It is joined with each other by the isthmus. Then next coming to, there is a third lobe of the thyroid gland, that is the pyramidal lobe. It may project upwards from the isthmus or from one of the lobes. So here we can see a diagram I have made. Here this is the thyroid gland. Here we can see this is the isthmus region. And here we can see it is the right lobe and the left lobe which is connected by the isthmus. So friends, next coming to this, sometimes a fibromuscular band, that is a fibrous band, descends from body of the thyroid bone to the isthmus to the pyramidal lobe, which is known as the levator glandular thyroid. So here we can see in this diagram, this is the levator glandular thyroid. Here I have made this diagram showing the vertebral levels, that is the C3 and C4, C5. Here this one is the thyroid cartilage, and in the C6 level we can see here, and this is the C7 level and this is the T1 level. So here coming to the what is the function of the thyroid gland. Thyroid gland regulates the basal metabolic rate. It stimulates the somatic and the psychic growth, and it plays a role in calcium metabolism. Next coming to what is the situation and the extent of the thyroid gland. The thyroid gland, it lies against the vertebra, that is the C5, C6, C7 and the T1, which is embracing the upper part of the trachea. Each lobe extends from middle lobe of thyroid cartilage to the fourth and the fifth tracheal ring. So here we can see from the diagram, here it extends from C4, C5, C6, C7 and T1. And this is the fourth tracheal ring. And the isthmus, which extends from the second to the fourth tracheal ring. So next, starting with the dimension of the thyroid gland, each lobe is 5 into 2.5 into 2.5 centimeter and the isthmus is 1.2 into 1.2 centimeter. The weight of the thyroid gland is around 25 grams and it is large in females and it increases in pregnancy and during menstruation. The parts of the thyroid gland, that is the lobes, are conical in shape. Each lobe has an apex, has a base, and it has three surfaces, that is the lateral, medial, posterior lateral. It has two borders, that is the anterior border and the posterior border. Coming to the relations of the thyroid gland, apex, it is related to the superior thyroid artery and the external laryngeal nerve. So friends, we can see here I have made this diagram. Here this is the thyroid gland. This is the thyroid gland. Here this is the apex of the thyroid gland, and I have told you that it is related to the superior thyroid artery and the external laryngeal nerve. See, here this is the superior thyroid artery and this is the external laryngeal nerve. Then next coming to this, we can see the base. Base, it is related to inferior thyroid artery and the recurrent laryngeal nerve. So here you can clearly see this is the recurrent laryngeal nerve. Okay, and this is the inferior thyroid artery. This is the inferior thyroid artery and this is the recurrent laryngeal nerve, and thyroid gland's base is this one. So I have made this clear to you now. And next coming to the surfaces. This is the lateral surface, superficial surface, which is convex, and it is related to sternohyoid, superior belly of omohyoid, sternothyroid, and anterior border of sternocleidomastoid. We can make mnemonics here like SH, ST and SC, that is the sternohyoid, sternothyroid, sternocleidomastoid, and only one, this is the omohyoid. The medial surface, this is the medial surface, it is related to two tubes, that is the trachea and the esophagus. And next coming to, it is related to two muscles, that is the inferior constrictor muscle and the cricothyroid muscle. Two nerves, that is the external laryngeal nerve and recurrent laryngeal nerve. Next we will see the posterolateral surface or the posterior surface relations. It is related to, the thyroid gland is related to the carotid sheath, and it overlaps the common carotid artery. The anterior border, which is thin and is related to anterior branch of the superior thyroid artery. We can see here, friends, this is the anterior branch, okay, and this is the anterior relationship. Coming to the posterior border, which is thick and rounded, it separates the posterior and the medial surface. It is related to inferior thyroid artery, anastomosis, and between the posterior branch of the superior and the ascending branch of the inferior thyroid artery. It is related to the parathyroid gland and thoracic duct only on the left side. Next coming to the isthmus, it connects the lower part of two lobes. So it has two surfaces, that is the anterior and the posterior surface, and two borders, that is the superior and the inferior border. So friends, in this video I tried to explain the whole anatomy of the thyroid gland, the relations and the diagram of the thyroid gland. And in my next video I will be making a video on the blood supply of the thyroid gland, the examination of the thyroid gland. So hope you liked my video. Meet you in my next video with a new topic. Till then, bye bye, and like, share and subscribe to my channel, friends. Pratibha's Nature Delight. Thank you.